if you want to build strength and if you want to continue building that strength later on into life, possibly using squats, deadlifts, mainly the squat we're going to be referencing in this tutorial, and also if you want to minimize your risk of a spine injury, then I'm going to recommend that you stop hip winking or butt winking or whatever term you give it. What we're going to do in this tutorial is, first of all, I'm going to quickly talk about what the butt wink is, or hip wink. Then we're going to look at the injury mechanism it's creating. Then we're going to look at some factors affecting how deep one can squat. And then we're going to look at, in sort of the final part, are some sort of observational skills that one would need to be able to get the right foot position and also the right squat depth as well. So first of all, part one, what is a hip wink? So if you can imagine, this is the pelvis and this is the L5 lumbar vertebra. So as someone squats down, they're in their nice neutral posture, and then all of a sudden they sort of break apart and the hip tucks underneath the lower back. That, in its most basic form, is a hip tuck or a hip wink. And it's that we want to be avoiding. And the most fundamental way of doing it is not squatting quite as deep. But we will talk about that later on, and we'll talk about some of the sort of caveats and nuances that come along with that. Why am I suggesting stopping the hip tuck? Well, for one, in some respects, very simple reason, is it's moving you towards a spine injury. Now, again, we're going to talk about some caveats and nuances about how and when that will happen, or potentially when that will happen. But for now, it's certainly every time you do it, it will move towards a disc injury. It could be a disc bulge, it could be a full disc herniation. So what is a disc bulge or a disc herniation? How does that happen? Well, again, if you can imagine, that's my pelvis. So this is the S1 vertebra. And then you've got L5 on top of it. And then you've got the disc in between. So that sort of empty space in between is where the disc would be. Now, every time they break apart like that, so that's neutral. And every time it goes into flexion or into that hip tuck, you get what is a jelly-like fluid on the inside of the disc gets pushed towards the back. And over time, that moves towards the edge of the disc and eventually turns into a disc bulge and a disc herniation. Now, just to cover that in a little bit more depth, if we then take L5 off of that little sort of imaginary or metaphorical picture that we've created, and we're now looking down on the disc, so we've got a bird's eye view of the disc, it will look something like that. So it's not perfectly round. People do have different shapes, and certain shapes will be, or a certain shape will move you towards a disc problem quicker, and one it will take a little bit longer, just simply because of the anatomy of the disc. Now, you've got that jelly-like fluid in the middle, but what you've also got is a fibrous wall on the outside. So imagine it a bit like the rings on a tree. And then what happens is with every flexion, so if it keeps happening, every flexion, it's getting pushed towards the back of the disc, and the fluid will sort of meander and make its way up over and through these fibrous walls until eventually it either bulges, touches the nerve and gives you a back injury, or it goes through a full herniation and again gives you that back injury. Now, what we're going to talk about in the next part are some factors that affect how quickly that is happening. The first factor is load and or versus cycles. So what that basically means is the heavier the load and the more you do it, the quicker that injury mechanism will be happening. So you will move towards a disc injury a lot quicker. Now, obviously, I've mentioned that there is an anatomical advantage and disadvantage certain people have. But again, we don't know who they are. We can look at the body and get an understanding of it, but we don't truly know. So until we can get an MRI scan or some sort of X-ray of the disc to understand that, then we're not really going to know. So I personally would never use it as a means of of understanding how deep someone can go and how much they can round their spine. So if people are using that, unless they know the shape of your disc, then don't listen to them. So coming back to load versus cycles. So what we've basically got, if you were to body weight squat right down to the bottom and you rounded your spine, you've done it once, so that's low cycles, so that's low how many times you've done it, and it's a low load. That is the other end of the scale, so that will be moving you the slowest, if that makes sense. What we've then got obviously on the other end of the scale is that high load and high cycles that I talked about. So we're using a heavy weight and we're doing it a lot. And then we've got everything else in between. So it might be a high load, but you do low reps. Or it could be a low load, but you do it a lot of times. So you've got all of that in between to work out. So what's better, what's worse, how much should I do it, when should I do it, so on and so forth. So you've got all of that to take into consideration. So that's the sort of first factor affecting is how much you load the spine and then how many cycles of that loading that you do. The second one is the anatomy of the hip. So I've talked about a disc, but now I'm going to talk about part of your hip as well. Now, there are, in general terms, there are two types of hip socket. There is a shallow one and there is a deep one. A shallow hip socket can squat deeper than a deep hip socket. The shallow hip sockets generally are found in Eastern European and Middle Eastern hips. So those people, you will generally find they can squat deeper and maintain that position of the spine. When we move across to sort of like Western Europeans, they will tend to have deeper hip sockets, and they won't be able again to squat as deep. Now that is sort of wiping it with a broad brush, because individual to individual, we don't know, because there will be some Eastern Europeans that have deep hip sockets and there will be some Celts that have shallow hip sockets. So again, we can't just wipe it with a broad brush like that, the same as we did with the discs. So we've got to have some degree of an objective view of what the hip socket is. And again, we could do that through MRI, X-ray, some sort of scanning on the hip to be able to find out if it's a shallow or deep hip socket. If we can't do that, again, we generally haven't got that, excuse my phone, we haven't got that objective view. So what we have to do is get a better understanding. So what we're going to look at in the next part is how we can start getting that better understanding without those objective anatomical views. So finally in part 4, we're looking at 2 observational skills that we need to be able to know what foot position to have and how far down we can squat, so how deep we can squat. Number 1 is going through some sort of assessment of the hip, one of them being a hip scour. It's promoted by Dr. McGill. There are some, let's just say, limitations to it, which I will go through in a second. But essentially what's happening is you've got someone led on their back, you are holding knee and foot, knee is say at 90 degrees, then you go into a deeper hip flexion, and then you allow the hip to guide how deep it can go and where and how far round the hip it can go. So that is the hip scour. You would then get them into a quadruped position on all fours. Then you would look at how far are the knees apart and how deep can they squat into that position whilst maintaining a neutral spine. So those are sort of 2 skills to have: the hip scour, and then in the quadruped, taking the bum towards the heels, being able to notice when the hip tucks underneath. So you just don't go that far, essentially. So that in some respects is skill number 1, but the most limiting factor of that is the hip scour. When you're led on your back, muscles relax. So it will give you a slightly different representation of the hip flexion that someone can go into, or that you can go into. Because as soon as you come up onto your feet, your hips and your muscles are going to react very differently. What it also does is it takes the ankles out of the equation, because you're only looking at hip flexion. So you might be looking at how far the hip can flex, but you're not looking at how far the ankle can dorsiflex, which will also be a part of the understanding that you will need. So those are the two limiting factors of the not only the hip scour where they're led on their back, but also when they're in the quadruped position, going back into that deep squat position, bringing the bum towards the heels and noticing the position of the lumbar spine. The second observational skill, and probably most important one that certainly that I use, is getting them to squat and looking at where their spine or their hip tucks. So we're looking at where their spine flexes or where their hip tucks. Now, what can be useful from the hip scour and being on all fours and bum to heels is you can get an idea of foot position. Now again, it's not going to be an exact science, but you will get an idea of it. So what you can do is you can then get them into a standing squat in that rough position, and you can then get them to squat down. Again, noticing how far down they can go whilst maintaining that neutral posture. What you can then do is experiment. You can go a little bit wider, try it again. Do they go deeper? You could go narrower, try it again. Do they go deeper? You can have feet parallel, try it again. Do they go deeper? You can have feet slightly sort of pigeon-toed. Again, go down. Can they go deeper? So you're trying to find it in that squat position, because as I mentioned, when you lie them down or get them on all fours, the hip muscles are going to react very differently, or they could react very differently to when someone is stood up. So the best way of doing it is just observing them in that squat and then experimenting with the foot positions, but using the hip scour and the on all fours quadruped, and then bringing the bum to heels as a guide. But again, it's not an exact science, it's not a definite science. If it shows up one way in the hip scour, then that doesn't mean it's going to translate into the standing position. So it's understanding those limitations. But one thing that you can understand is when they're in that position, are they keeping a neutral spine throughout the position or throughout the squat? That is the one determining factor that is unchanging, if you will. Quick summary of everything that we covered. Number one, the hip tuck is where the pelvis tucks under the lumbar spine. Number two, the injury mechanism that it's moving you towards, or the injury that it's moving you towards, is a bulging disc or a herniated disc. Number three, some of the limiting factors of understanding that, or of moving towards that injury. One is the anatomy of the disc. Two is the anatomy of the hip. And then three is the loading and the amount of cycles that you do. So how heavy the weight is and how many times that you do it. Obviously, the heavier and the more you do it, the quicker. The lighter and the less you do it, the less it's going to happen. And then finally, we've got the two sort of, or three observational skills. Number one is the hip scour. What hip flexion can they have? Number two is getting them onto all fours, bringing the bum towards the heels and watching the neutral spine. But again, there's limiting factors with that, because if they are led down, the muscles are going to react very differently to when they're stood up. Plus, it also takes the ankle out of the equation. So the number one determining factor is getting them into the squat position, experimenting with foot position and sort of toes in, toes out, and watching their spine or their lumbar spine and maintaining the neutral position, but using the other two as a good guide. So many thanks for watching. My name is Chris. I will speak to you in the next tutorial.